We've been joined by Delhi's top known and most loved pediatrician, Dr. Nitin Verma. Dr. Nitin Verma, thank you very much for speaking to Republic. The COVID cases are on the rise, and it's a cause of concern not just among the youth, the elderly, but also now to children. You're a pediatrician, and I wanted to know from you, Dr. Nitin, what is it, what are the early symptoms that we see in a child when the child is first detected with COVID, especially with the new variant that we have just discovered?
Okay, so let's understand one thing to start with. COVID is here to stay. It's endemic, and periodically we'll keep getting cases. The cases that we are getting now are the LF7 and the NB1.8. These are strains of the JN1
Right.
Omicron variant which are there.
Right.
Most of the cases that we are getting are very, very mild, and I've seen 2 children in the last 7 days who tested positive. Unfortunately, both of them picked up from grandparents who traveled from abroad.
Right.
So they were not local cases.
Right.
So sore throat, fever, little bit of cough, fatigue, sometimes a little bit of cold. So symptoms indistinguishable from normal flu. What we need to know is that we need to have a high index of suspicion. So we should always
Right.
keep COVID in our mind when we are dealing with viral cases.
Absolutely. Dr. Nitin, what do you recommend as the first steps when we talk about the child first detecting COVID-19? What are the early steps that the child should take forward?
So as I said, it's pretty much like the normal flu. It's mild. I don't think there is any need to panic at all. First, what we need to do is we need to isolate the child, because what is important is to prevent further spread. And we know that the vulnerable against COVID are small children, the elderly, and people with comorbidities. So
Right.
isolate. One of the parents can isolate with the child, use a mask, and watch out for any signs of very, very high fever, cough getting worse, noisy breathing, or not feeding well, not looking active. By and large, simple management with paracetamol, giving a high protein diet, lots of fluids, some vitamin C will be sufficient for the child to have an uneventful recovery.
Right. Dr. Nitin, what would your advice to be to those mothers who are expecting a baby? Because during those months as well, a mother needs to be extremely cautious about her surroundings as well. So what would your advice be to those mothers?
So, what has happened is that we have very short memories. We've forgotten the bad days of COVID, the days of the second wave. And what we were taught was very, very simple: social distancing, wearing a mask when you're with other people, hand washing. That's all you need to do, because a pregnant mother is very, very vulnerable, because she is vulnerable and so is the baby who's not born as yet. So she should be careful with whom she mixes,
Right.
wear a mask when she goes to medical facilities, and make sure that she takes her influenza vaccine. That tends to help out as well.
Right. So, doctor, when a child detects the COVID in the first stage as well, during the initial days, do you recommend the child and their parents to first treat the initial symptoms like that of fever and fatigue with a normal medicine like we eat in everyday life, like a dolo, or do you recommend them to go to the doctor first and then take the necessary steps that the doctor's advice?
So actually, the one good thing is that most children have a regular pediatrician. So certainly consult your doctor on the phone. I think there is no need to rush. There is no need to, run to a hospital. Treatment is symptomatic. Just manage the fever and fatigue with paracetamol, as you said. Take lots of fluids, take a high protein diet, and stay in touch with the doctor. If you find that there is any worsening of symptoms, then certainly take the child and have the child examined.
Absolutely. Doctor, what would your last word of advice be to every parent that is watching this show right now? Because it's become extremely worrisome, the situation right now. Everybody is saying that the COVID is back, the surge is back. So what would your initial advice be to all those viewers of Republic TV who are watching this show?
So two, three quick things to remember. This is a virus, and we got immunity either through a vaccine or through getting COVID.
Right.
As a period of time extends, the immunity tends to wane, though the body has immunity. That's point number one. Point number two, holiday season. Everybody is traveling. The world is one place. Schools are going to shut. Everybody is traveling. All I'm telling people is do not panic. It's a normal virus. Lead your life. Be cautious when you go to crowded places or you go to medical facilities. Mask up, wash your hands, try and keep your distance, live life normally.
Right. Thank you very much, Dr. Nitin Verma. It was lovely speaking to you. A very insightful session indeed. I'm sure it's going to help all our viewers and every parent who's watching this right now. Thank you very much for speaking to Republic.
Thank you so much.